glad actually Dr. Gatt is here because, you know, I happened to sit next to somebody from the East Coast who was the main lecturer for psych on this conference. And one of the things that he presented, and it really sat with me, he said, I have an office full of patients that come and see me desperate. You know, they did everything they could. They lost weight, they plateaued, or they're not losing more, they're gaining weight, and kind of depression sets back in, and they come to the nutritionist, they see the nutritionist, and then they go to the surgeon, and then like he's the last port of call, you know. So, and he really hammered it, I think, for me, is that he said, I tell these patients, there is no failures. It is just delayed success. And I thought that is so true. I mean, I never thought of it like that, you know. And it's not that, you know, we talk about 80% weight loss, 70% weight loss, but a big message in this conference was those are really just numbers. The true value of these operations is in how you feel after your weight loss. Okay, you have guidelines, but if you don't fall within that range, doesn't mean it was a failure. Majority of patients start to feel better. You start to improve in terms of your nutrition, your cholesterol levels, your blood pressure, your sugar control, and overall whole approach to life, your confidence level, your demeanor. But some feel that, oh, they didn't get to the 80th percentile and they fell. And his message was that's not the case at all. And this was actually across the board. The surgeons talked about this, the nutritionists talked about this, that if you did everything that you knew was the right moves and you didn't get to that target value, but you're happy with where you are, that is great. And you should be very pleased with that, because had you not reached to that level, 5 years, 10 years from prior to your surgery, your risk of developing strokes and heart attacks and blood pressure problems would have gone up, and your certainly longevity is lower.